her screen, MomDoc. She's a dual trained physician in emergency medicine and family medicine. She's committed to delivering high quality, patient centered care across all stages of life. She has a strong foundation in both acute and primary care. She brings a comprehensive and compassionate approach to medicine, bridging the gap between emergency treatment and long term wellness. A professional focus includes preventive health, women's wellness, and community education, with a mission to make healthcare accessible, empathetic, and empowering. So, part of the aim of the Let's Talk Nation Building webinars is to ensure that the public in Trinidad and Tobago knows that there are people who, despite religion, despite race, culture, creed, political persuasion, who are continuously making efforts to improve the national experience. Dr. Chandler is someone who has had a history of working towards making medical care accessible to those who are on the fringes. Some of the work that she has done is mainly in terms of educating students in the school system to understand wellness and health. And during this month of cancer awareness, her approach with her team is to ensure that people throughout the nation are aware of the impact of cancer, breast cancer in particular, since it impacts women and girls, so that we can understand what it is, what we can do to prevent it, and also what we can do if we find ourselves succumbing to this disease. So on last Saturday, Shada did a wellness, Dr. Shada was a student at Holy Faith Convent, Vancouver. So just switching between student and adult professional here. So Dr. Chandler was gracious enough to do the breast examination process so that women could understand what to do to examine their breast to see if there is a need for further test in order to ensure that the scourge of cancer is reduced. So without further ado, I want to welcome Dr. Shada Chandler, MomDoc.
Hi.
Welcome, Dr. Chandler.
Hi, everyone. Sister Teresa, you didn't tell me it was going to be so serious.
Well, I have a serious face. I just have a serious face.
I know, that was such a grand welcome. But because I didn't dress up, I was outside with my daughter. I was driving home. Okay, thank you so much, Sister Teresa. I was trying to figure out how to change my background, but you'll just have to take my background for what it is, because I had to distract my daughter and kind of plant in front of the TV with some food so that I could get some time to do this, because this is kind of like wind down time for us. But thank you.
We appreciate the effort, Shadi.
Yeah, thank you so much. And I'm not even looking so cute. I'm feeling so untidy, but this is the real Shadi, I'm being honest.
Exactly.
Yeah. Okay, so like Sister Teresa said, I am an alumni of Holy Faith Convent, Vancouver. From 2001 to I graduated in Form 6, I think, in 2008. I went to medical school in Grenada. I went to St. George's University in Grenada. And then I did my training in the US for 3 years after Grenada. And I came back to Trinidad for 1 year, and I went back to Grenada, and I taught in medical school to med students for approximately 1 year, because I knew I wanted to do clinical medicine and academic medicine. So the reason for going back to Grenada to teach was to kind of like feel it out. I have been employed with the SWRHA for the past 8 years. I work in Cooper District Health Facility, Accident and Emergency. I am a registrar in accident and emergency. And I also have an office as well. Like Sister Teresa said, I am dual trained in terms of emergency medicine and general practice medicine. So there's a kind of like a acute medicine thing that we call it. I am a single mother. I have a 6-year-old daughter. And lately, I find I don't have any more hobbies because I've just become very consumed with work and her and complaining about how standard one is so much work and so much work and so much work. But yes, I do have a passion for medicine. I can't see myself doing anything else. I love emergency medicine because there's this acute change. Like I like the adrenaline. I like the emergency medicine part of actually saving someone's life. That's the part of emergency medicine that I like. And then as I opened an office last year, I'm actually getting to see the family medicine side of things and actually getting to sit and talk to a patient and hopefully bring some change within the community of MacBean because that's where I reside. So without further ado, let me see if I could share my screen. So that you all can kind of follow along with me. I'm going to give a brief talk on breast cancer awareness. Allow to share screen. So tell me. Just give me 2 minutes. Let me find the presentation. So tell me if you all could see my screen. Wait, yes or no? You are presenting.
Seeing all the different things on your screen.
Okay.
Your whole desktop.
Seeing your screen.
Can you see my screen now?
Yes, you see your screen.
Yeah, so you see the presentation, right?
Yes, we are seeing breast cancer awareness.
Right, very good. Okay, good. So breast cancer awareness. So as we know, October is the month of International Breast Cancer Awareness. I don't know why we only celebrate it well, not celebrate it. We bring awareness for 1 month, but it's something that it's an ongoing process or something that we should practice year round in terms of bringing awareness to people. Okay, so the whole idea of breast cancer awareness is that early detection saves lives, right? So moving into the first slide, so it talks about what is breast cancer. So people always saying breast cancer, what is it exactly? So breast cancer is a type of cancer. It begins in the cells of the breast. So what happens is that it occurs when normal cells in the breast, they kind of grow out of control and they may form a lump or something that is called a tumor eventually, right? Sometimes the lump may not be palpable. And then as the palpable, meaning you cannot feel it with your naked hands, and then as the lump grows, then it will become more palpable within the breast tissue, depending on the size of the lump and depending on the amount of fatty tissue within a patient's breast or a person's breast. So if you look at this picture, I just want to show you all a little bit of anatomy. So I'm coming out. So if you look at this picture, the first picture here, this is the muscles of the chest wall. So both men and women have breasts. Let's take that into consideration. Muscles of the chest wall is this pink layer here. These little white structures are what are our ribs that underlie the breast tissue. The breast is made up of fatty tissue. All this is fatty tissue. And then there's a glandular aspect that attaches to the nipple and the areola, right? This yellow aspect is what we call the skin, the overlying skin. So this, in the first image, you see a small lump sitting here. So this is an abnormal growth of cells within the fatty tissue. And this lump may be the size of a popcorn kernel that you may not be able to palpate with your naked hands, right? And then over time, of course, it will grow and grow and grow. A lot of the times, breast cancer is kind of slow growing. So it will grow at this point here. This may be maybe like a year after you might start feeling something if you do your breast exams. And then 2 years later, it may get to the size of what we see here, right? And it grows from the inner core of the lump outwards, right? So, yeah. So why is awareness important? Like I said, early detection through awareness and regular screening, which we will talk about later on, it would lead to successful treatments and actually saves lives. And what I've realized during the month of October and doing all these breast cancer awareness talks is that we have a taboo within our population where women are very afraid to even feel their own breasts for whatever reason. It's something that I myself ponder on after I interact with a lot of women, because I've met a lot of women over the past month, and I don't know what it is. We just not that we don't want to do it, but we're afraid of kind of finding out anything, if there's anything at all, right? Okay, so that's what is breast cancer. So some facts and statistics: about 1 in 8 women will develop breast cancer within their lifetime. So that's a very significant number when you think about it. So this is for the population within the developed world or the developed countries, right? For Trinidad and Tobago, I went to a talk yesterday with TTMA, Trinidad and Tobago Medical Association, and our statistics is 1 in 9. We go by the PAHO guidelines because we are a developing country. And the reason as to why we are more 1 in 9 is because, 1, there's later detection, and 2, not a lot of screening within the public system that should be done, right? So it's, even though it's 1 in 9, it's still a significant number. So in a room full of men, like I did a talk and there was only men in the room, and they were looking around like, this won't affect me, but what about your mother, your auntie, your girlfriend, your sister? So 1 in 8 to 1 in 9 women around you as a man would be affected by breast cancer within your lifetime, right? It's the most common cancer among women worldwide. Reason being, not only, well, women alone don't have breasts. Men, believe it or not, have breasts as well. And the statistics for breast cancer in men is 1 in 19. But it's the most common cancer among women worldwide. Survival rates are usually high if we detect it early, at over 90% at early stages in terms of the survival rates. And survival rates would be at stage 1 or stage 2 in terms of detection, where you could do simple lumpectomy or chemoradiation, etc. Okay, so in terms of risk factors, so a lot of people have been asking, so how do I know if I will get breast cancer? What are some of the risk factors for it? So in medicine, we would learn about modifiable and non-modifiable risk factors. So basically, a modifiable risk factor is something that you tend to have control over, right? So it would be lifestyle choices such as your diet or exercise, overconsumption of alcohol, cigarette smoking is a lifestyle choice that you make that you could adjust. And then in some women who may have to undergo HRT or hormone replacement therapy, that would be in your women who may have to have a hysterectomy because they would have had a uterine fibroids and they have to take HRT or hormone replacement therapy to kind of balance all the hormones. Or even women who enter in menopause, they tend to go on hormone replacement therapy by choice in order to deal with some of the symptoms of menopause, right? So those are things that you tend to have control over. And your non-modifiable risk factors include things like your age. So with any malignancy or any cancer, your risk for that cancer would increase with age, right? Then genetics. So if there's a family history of breast cancer, there's the famous BRCA1 and BRCA2 genes that young women may be diagnosed with breast cancer in their teens into early 20s. And if they have children by, say, 30 or so, their daughters have to be screened at an earlier age because they have that gene and they tend to develop breast cancer. And then if there's a personal history of breast cancer or certain other benign breast diseases, which I will talk about later on, right? Okay, so what are some of the signs and symptoms of breast cancer? So when we look at the images here, which I will come out to show you exactly, just 1 second. Sorry. Right, so some of the signs and symptoms of breast cancer. The first sign would be a new lump or mass in the breast or underarm. If you do your self-exams, you would tend to have an idea of what the normal breast tissue feels like versus if a lump just shows up. So in this first image right here, this is the breast, this is the areola, part of the areola, and this is the nipple right here. And if we look, we see a lump right here, right? So that's a new lump in the breast or the underarm. Why the underarm? Because the breast tissue extends all the way into the axilla. And a lot of the times you may not be able to feel a lump with your fingers within the breast, but there may be a lump within the tissue, and that lump drains into the lymph nodes of the axilla. And the first sign may be a matted or hard, firm lump within the axilla or the under armpit, right? The next thing, you may see a change in the size, shape, or appearance of the breast. So looking at this image here, what we see is something called a skin change or dimpling of the breast. So you have the normal breast, and then you see the breast has some kind of, it looks kind of like what cellulite looks like. So that's dimpling or retraction of the breast tissue because there's an underlying lump that is pulling the skin or making the skin a little bit taut, right?
Dr. Shada,
yes.
I just want to interrupt. I'm not seeing anything on the screen except MomDoc. I don't
Really?
know what the others seeing. Are you all seeing the visuals? Hello? Janelle?
No, we are not. No.
Okay, so I don't know. Maybe you have to reshare, Shadi.
I am not. Yes, no, we're not seeing it. Yes, that is true, sister.
Let me see what's going on here. So you're not seeing me at all?
Mom presenting, only coming up, nothing else.
So you all didn't see the presentation?
We saw the
I saw the initial picture with the three breasts.
But after that, no.
So you're not seeing this?
No, we're not seeing the breasts anymore. We're not seeing the breasts anymore.
Just seeing your icon.
That's not well. Let me see if I could figure it out. Update your browser to use visual. Just no, I'm trying to figure it out. You presenting. So can you all see me though, or no?
We will see
you. We're not seeing you neither. Just the icon.
Just the icon.
I think somebody's seeing.
I'm seeing the signs and symptoms. I'm seeing pictures.
You seeing this?
Yeah, I'm seeing pinkish background, signs and symptoms with different breasts.
Yeah, you seeing it?
Yes, I'm seeing it.
Okay. Well, then something is going on with my network then.
Play the slide.
I'm not seeing anything. I'm not seeing anything.
I'm seeing a blank screen.
So it must be our network
Because
So
for me, it says currently sharing and presenter overlay.
so you're seeing something is wrong with the network in Cuba then, in our network. I'm seeing it now.
Large.
Yes,
I'm
I'm seeing it now.
Seen it?
Yes, I am. Yes, I'm seeing.
Okay. So y'all seen this, right? The breast?
Yes.
Yes,
Okay.
we are. Yes, I am.
Oh, sorry. Come back down. Just now. So this and this. Okay. So I was talking about the new lump. So y'all seen my cursor?
I'm seeing a blank screen.
A blank screen?
I'm seeing you. I'm seeing the screen with you, but you are in front.
But you're not seeing the presentation.
I'm seeing the presentation, signs and symptoms, but you are pinned. I don't know if I pinned you in error.
Somebody mic. Yeah. So are you seeing signs and symptoms?
Yes.
Yes?
Yes.
Okay. So can I go ahead?
Yes, you could go ahead.
Okay. So I'll just start over from this slide, but everybody seeing?
I am. Winston, are you seeing?
And Sister Teresa, you seeing me as well?
I'm seeing a sign this video is supposed to use the problems with your network.
With my network?
With my, I guess it's mine. You're talking to me.
Yeah.
I'm seeing the same thing to Sister Teresa. So probably the network in Cuba area giving problems.
But anybody else seeing signs and symptoms?
Nope.
I'm seeing you in front of the screen now.
What is going on?
Yeah, previously I was seeing the screen, but now I'm seeing you in front of the screen.
I don't know what's going on because to me it's saying that it's sharing, like it's actually sharing. Let me stop sharing and let me open it back again. So stop sharing and let me share again. Share screen, allow to share window, allow to share screen, large. Meet needs permission to screen share.
Beverly, you might need to give a screen sharing permission again.
Yeah. It says that I need to get screen sharing permission. Allows always show my photos. Meet needs permission to screen share in this environment. Select settings for options to ask. Can you give me permission?
Beverly, can you give her permission to share, please?
Beverly there?
Okay, just now. Let me see what's happening here. says you have permission to screen. Maybe the internet is bad. I don't know.
On my side, it says that it is sharing. Yeah, right. So do you see the presentation? Can you see it? Okay. Anybody else having that issue?
Same thing that we're seeing.
Same thing. Oh my goodness. Let me see. Let's not get frustrated. Let me stop sharing and I'll share again. Share screen small. Anything?
1,001 things.
I know it. That's true.
Yeah, seeing it now.
Seen it?
Yes.
Seen it? Yes?
Yes, seeing it
I'm
clearly.
seeing it.
Okay, great. Right. So we resume. I can't use my arrow to point. I'll just talk. So the top left-hand picture shows a new lump or mass in the breast, and you see it right above the areola. I can't use the mouse to point because of how I'm in the screen mode. And in the picture to the right of that, to my immediate right, you could see some skin dimpling within the breast, and that's the point where I had reached. So usually there's a lump within the tissue of the breast in this picture that is actually pulling the skin taut or making it into a dimple or a cellulite looking appearance, right? Then to the bottom left image, you see an image that looks kind of like open pores. So this is the most aggressive form of breast cancer. It's called inflammatory breast cancer, and this is how it looks, right? Initially, we call it a peau d'orange, so it looks like an orange, like how orange peel looks. And this type of breast cancer goes missed a lot of the time in the Black population because they just think that the breast's changing and they can't feel any lumps, but it's actually an aggressive type of breast cancer. Then in the bottom right pictures, you see some images that are showing some nipple retraction. So some women tend to have inverted nipples, which is anatomically normal or they're normal. But if your nipples have always been outward and over a period of time, you realize that they start pulling in. That's what we call nipple retraction, right? So that is some underlying malignancy or lump that is pulling the nipple inwards. And then the last image to the right, you see some bloody nipple discharge. So nipple discharge is never normal. The only type of nipple discharge you should have would be milky nipple discharge in a lactating mother or a mother who would have had a baby recently. Any type of bloody nipple discharge is never considered normal. So signs and symptoms: a new lump in the breast or the underarm, change in size or shape or appearance of the breast, unexplained pain in the breast or the nipple, skin changes like dimpling or redness, and then nipple discharge other than breast milk, of what I would have alluded to, right? Okay. So this slide just talks about what I mentioned before, the importance of early detection, and that early detection or detecting breast cancer increases the chances of successful treatment and survival, and it can prevent cancer from spreading and, of course, reduce the need for more invasive treatments. So in the early stage on diagnosis, we would do a lumpectomy. That would be the initial thing, versus other invasive treatments would be things like chemo, radiation, mastectomy, etc. So the most important thing or highlight of this would be screening methods, right? How do we check for breast cancer? Seeing that is the most common cancer in women, how do we check for breast cancer? So the first thing, it starts with you, a woman who has breasts. You are responsible for doing your self-examinations. Ideally, we are supposed to regularly check our breasts at home, usually, or it is recommended at a minimum twice for the month. In a menstruating female or a female who still has her period, the best time to check your breasts would be on day 3 or 4 of your period, which is day 3 or 4 of menses or bleeding, after the start of the period. And then the other time to check your breasts would be about 1 week before the start of your period. If you check it randomly during the month, that's fine. At least checking it is better than not checking it at all. And then after you do your self-exams, it's recommended that you do clinical breast exams, which is performed by a healthcare professional like myself. With a trained hand, we know what to feel for, what normal breast tissue feels like, what abnormal breast tissue feels like, what a benign or non-cancerous lump might feel like, what we call a fibroadenomatosis breast might feel like, a very glandular breast would feel. We know what a breast feels like when you're close to your period, when you finish your period, when you're lactating, if you have children, if you don't have children. A trained hand, we know exactly what to feel for and how to feel, right? A lot of the times women be like, "Doc, but everything feeling like if it have lumps," but that's just a very glandular or dense breast. So it's important to do a clinical breast exam. In the ideal world, where they have great healthcare in developed countries, they recommend that a clinical breast exam should be done at least 3 times for the year, but that's kind of impractical for us in Trinidad and Tobago as a developing country. In terms of screening methods, mammography. So a mammogram is the gold standard with respect to checking for breast cancer, right? So what a mammogram is that it's just it just takes an X-ray of the breast, and it's a machine. The breast is kind of put in the machine, and it squeezes the breast, or people say it squeezes the breast, and it takes images or pictures of it, and is able to detect even the smallest lump that you cannot palpate as a clinician or even as a patient yourself, right? A lot of women say, "But doc, I want to do an ultrasound." Ultrasound scans is kind of user dependent. It's an additional test outside of the mammogram to kind of look at areas that appear abnormal on the mammogram or physical exam. And of course, in pregnant women, because you can't use x-rays in pregnant women with suspicious lumps. But the gold standard is your mammogram after the age of 40. You could do a mammogram if you're under 40 and your clinician finds that there is a suspicious lump that needs to be evaluated, or if there's a strong family history of breast cancer, right? So the images below show a normal mammogram. Then the one in the middle shows a benign cyst, which is like not cancerous. And then in a cancer, the lump appears a lot different. It's very, what we call hyperdense. It's very white, and the borders are very spiculated, not round and smooth like in the cyst, right? Okay, so how do we perform our self-exams? In my presentations, I demonstrate to the woman how to do your self-exams, and I have some breast models that we were teaching women how to palpate and feel for the lumps within the breast as well. So most of the women I don't want to assume, but we should know how to perform a self-exam. So you look at your breast in the mirror for any visible changes. You raise your arm and you look for changes in the shape or the skin of the breast. And then you use the ball or the parts of your fingertips, your index, middle, and ring finger, and you start in a 12, so the breast is divided into quadrants. You have so it starts from 12 o'clock, just like a clock, 12 o'clock. Then you have 3 o'clock, 6 o'clock, and 9 o'clock, right? We usually go in a clockwise direction using the parts of your fingers, and you go around in a circular motion, and you palpate on deep palpation to feel if there's any palpable lumps or anything that feels irregular to you. If you are used to doing your self-exams, you kind of tend to know what your breast feels like. So if there's anything that feels abnormal, you're able to identify it. You could do it standing up. So you use your right hand to check your left breast, and you open up the axilla. I have a picture later on that I'll show you. And you use your left hand to check your right breast. And always go into the armpits to feel the nodes if anything feels matted or hard or firm, as well as you always squeeze the nipples to see if there's any nipple discharge, right? So that's your self-exam. So this image kind of shows you what to do. So the first column, you look standing in anatomical position normal. You put your hands on your hip. Then you open up the axilla by putting your hands behind your head, right? Then you start touching. So there are different ways. So I explained the circular motion. So this one kind of shows you sweeping lines up and down. You could do it like that, or you could do the circular motion where you go all the way around, and then you come back to the top by 12 o'clock and squeeze your nipple. Or you could lie down, and when you lie down, you lie on your back. Like I said, to opposite hand to opposite breast, and always go into the axilla to check for your lymph nodes, right? So the lymph nodes kind of feel matted. It might feel like a corn kernel. Usually a lot of the time, believe it or not, women feel their arms and they go to their doctors because they didn't feel anything in the breast, but they'll be like, doc, I felt my arm and my arm feels very firm or hard. Can you check me out? And when you check them out, you might feel a palpable lump, send them to the mammogram, and stage 2 to 3 breast cancer, right? Okay, so in terms of they ask, so what can I do to decrease the risk of developing breast cancer? We spoke about the modifiable and the non-modifiable factors already. So some of the healthy life tips for any type of cancer in general: avoid the cigarette smoking, you stay physically active, limit your alcohol in consumption, and eat a balanced diet, stay physically active, maintain a healthy weight, right? This is just a slide showing some support and resources that we could go to. So in Trinidad and Tobago, you go to your local clinics, like your health centers. Your GP should be able to offer you information on screening and breast cancer. Or if you have a GP, you go to your GP's office to get examined and have that conversation with them in terms of your family history and all those different things. They make recommendations for you to have a mammogram, mammogram and follow up with your GP either in their office or in the health center. Sadly, we all know that things take quite a long time through the public system, but it's good to be in the system and do your necessary screening in terms of your breast exams and your pap smears and all of that, right? So call to action: get regular screenings as recommended. So when do we usually begin screening? So in a mammogram is by international guidelines, it should be done after the age of 40. You do your annual clinical breast exam by your clinician, and you do your annual mammogram. I told you all in the beginning, in Trinidad and Tobago, we don't do our mammograms annually. Reason being, by PAHO guide. No, I didn't tell you all that. I told you all about the statistics with respect to 1 in 9. So in the developed world, mammograms are to be done on an annual basis, meaning on a yearly basis after the age of 40. However, in Trinidad and Tobago, because we are a developing country and we follow the PAHO guidelines, we do our mammograms every 2 to 3 years as recommended by a clinician, right? Simply because we don't have the healthcare resources in which we could facilitate. In SWARA, we have almost 600,000 women that falls under the SWRHA belt. There is not enough radiologists to look at the mammograms. There's not enough doctors to allow women to, not allow, to push women into the system to get their mammograms done on an annual basis. So that's why it's done every 2 to 3 years, right? Locally, that's our standard. And then between the ages of 20 to 40 years old, you do at least 3 yearly clinical breast exams in the developed world. However, in Trinidad and Tobago, 1 yearly clinical breast exam is good, meaning you go to your doctor and you do a breast exam on a yearly basis. It doesn't have to be 3 as recommended by the developed world. And then women with an increased risk of breast cancer, meaning they have a family history of breast cancer, they have to do an annual breast exam by their clinician, a mammogram, and an MRI. So they have a step up in terms of their screening, right? Right, good. So we can't really talk about breast cancer and not adding cervical cancer, right? So cervical cancer is another cancer of the reproductive organs of women. And cervical cancer is, believe it or not, the most preventable cancer in women, thanks to our screening protocols and heavy vaccination. So cervical cancer is due to the HPV infection, usually strain 16 and 18. And people may ask, what are some of the symptoms? Symptoms include abnormal vaginal bleeding after intercourse or between periods. You shouldn't really have any intermenstrual bleeding, or after menopause, or what we call postmenopausal bleeding, foul smelling or abnormal vaginal discharge, pelvic pain, or pain during intercourse, right? How do we diagnose cervical cancer? Like I said, it's the most preventable cancer, and diagnosis is made by a pap test or a pap smear. And what that does is that it detects the precancerous lesions of the cervix. Actually, when you're going to do a pap smear and the cervix looks, you know what a healthy cervix looks like as a clinician versus what an abnormal cervix looks like. So what I do when I do a pap smear is that I take a sample of the cervix, 3 swabs, and you put it on a slide, and it's fixed on the slide and it's sent to be tested for HPV, right? And if it is that, it's sent to be tested for HPV as well as if there are any precancerous cells. After testing for that, you test for HPV and then you test for the strain of the HPV. If the pap smear comes back up normal, the next thing that I would send you for would be something called a colposcopy, which is just taking a sample or biopsy of the cervix itself, right? It's one of the most preventable cancers, like I said. Why? Because of our HPV vaccine, like Gardasil, which protects against some of the major HPV strains. And then routine pap smears that start at age 21. So in Trinidad and Tobago, our screening is done at age 21. You do 2 pap smears, 1 year apart, so on an annual basis. And then if you have 2 normal pap smears, after that, your GP would say, you're fine, you do your pap smear every 3 years on a 3-year basis, right? But if it is that your first pap smear is abnormal, then you have to have further investigation or annual screening. And some ways in which we prevent cervical cancer, of course, you practice safe condom sex, quit smoking, etc., amongst many other things. So that's just to add in a little slide on cervical cancer, because I believe that both cervical cancer and breast cancer kind of go hand in hand because they are screened for by your doctors. Of course, there are other cancers of the reproductive organs in women, in terms of your ovarian cancers or malignancy, the uterine cancers, etc. But these are the 2 that I decided to cover, right? So the breast cancer was a little bit, in terms of doing the presentation, I try to keep it very simple, just to know what are the basics that you need to know, which would be how to do a self-exam, when to do your self-exam. So you do your self-exam standing or lying, when to do it at least twice for the month. Guidelines say you should do it on day 4 of your period and a week before your period. However, in women who don't have a period, it's fine. You do it at any point during the month, at least get it done. And then see a doctor at least once a year to have a clinical breast exam, because what might be normal for you may not be normal for somebody with a trained hand. And then when do you do your imaging? So mammogram is after the age of 40, as recommended by your doctor, on a 2 to 3 year basis. And with your pap smear for cervical cancer, once you have a normal pap smear, after the first 2, then it's also on a 3-year basis as well. It doesn't have to be done annually, right? So yeah, I'm sure we all may know someone who has been affected by breast cancer. Like I said, it's very indolent. In the early stages, it's painless, meaning you don't have pain with a lump. But as it gets bigger and out of control, you start to get pain in the breasts and then pain in other organs, etc. So that is my that is all that I have for today. Anybody has any questions?
Yes, I have a few questions.
Sure.
And I just want to give others a chance to ask. Feel free to unmute your mic and ask whatever questions you have. I'm going to count to 3. And if you don't ask, I will ask. But I'm hoping that whoever has a question feels free enough to unmute the mic and ask the question at this time. But this is for your benefit. So make use of the opportunity.
Hi, good evening.
Hi.
Good evening, Cheryl.
Right. My name is Cheryl
Hi.
Lewis. Right. I had a sister who recently passed the 5th of last month. I think was cancer. Well, I really don't know as yet. Uterus or cervical cancer.
Mm-hmm.
What are the tests that like her other siblings should take along that line?
Okay, so in women, we have 2 reproductive organs, which would be our breasts, and the other one would be what we call the genitourinary aspect, which would be in Trinidadians we call it our womb or your uterus.
Yeah.
You have your ovaries, which attaches to the uterus, and then you have your cervix, which is the mouth of the uterus, or the mouth of the womb. So it's one organ, but you could get different types of cancers from it. So cervix, you get a cervical cancer. Uterus, you could get a what we call a endometrial or uterine malignancy or cancer, and then your ovaries are an ovarian cancer, and then breast is breast cancer. So it would be good to know what is the primary. So a primary is where the initial cancer starts, because remember, cancer spreads. So the primary could be, because you said you're not sure what type of cancer she had. How old she was?
Could have been 71. I think was in the uterus. I think it's
Right.
probably, yeah, in the
So I
uterus.
was going to say that. So endometrial cancer is endometrial is the uterine cancer. Endometrial cancer is usually postmenopausal, meaning women who would have gone through menopause, you're not supposed to have any kind of bleeding. If you have bleeding after menopause, something is wrong. It is a cancer until proven otherwise. So that age group would be an endometrial cancer. Cervical cancer would be like from age 30 until 50 or so. And then ovarian cancer is like 50 and under. Usually by 40, 41, they usually die. And nulliparous women, meaning women who never been pregnant. Ovarian cancer loves your nulliparous woman, right? So some of the tests that you would do for cervical cancer, like I said, would be a pap smear. First things first. Endometrial cancer, you have to do an ultrasound. So a pelvic ultrasound will look at the endometrial lining and tell you if, so the lining is what sheds during your period, right? And it's supposed to be a certain thickness. If it is too thick, then it could indicate some sort of what we call hyperplasia or overgrowth. And that would indicate maybe this person has something going on there that might need biopsy. But endometrial cancer most times always comes with some sort of bleeding or spotting. It doesn't, you must have some sort of spotting or bleeding, right? So that's one thing to look out for within you and your siblings. If anybody having any bleeding or spotting per vagina, any lower abdominal pain or pelvic pain or pelvic pressure or fullness in the pelvis. And then, so that's your endometrial cancer. Then, so I said cervical cancer is your pap smear. That's the only way to detect that one. And then your ovarian cancer would also be by ultrasound as well. Ovarian malignancies, you tend to get increase in your abdominal girths, meaning that you're telling your doctor you find you're putting on weight and your belly getting bigger and bigger and you're not eating much. And you just find the belly or the lower abdomen feeling very like pressure, like a heaviness. There are some blood tests as well. Called there's some blood tests, but they're not specific. So some cancer markers we call them. So you have your CEA, you have your CA 1919, and you have your CA 125. All those are for cancers of the uterus, the ovaries, and the cervix. But it's more so used for patients like yourself who would have had a sibling who would have died from one of those cancers. It kind of gives you a baseline, or if somebody's diagnosed with it and they get in treatment, it tells you those cancer markers kind of tells you how treatment is working, how whatever you're doing is responding to treatment, but not necessarily if you have cancer or not. So there's the blood test, there's imaging by ultrasound, and there's your pap smear, right?
Okay. I do not want to take much time, but the only complaint she had, which I find was strange, she said she saw no signs or symptoms. Well, we are all able to say, because March this year, she was good, very, very good. You see, she went on a cruise and you'll see her as normal. We never heard her complain about anything at all. It's just sometime around March, she said around her navel area, when she eat, it gets sort of hard,
Oh, mm-hmm.
right?
Mm-hmm.
And from since then, because I told her, so well, when you come to Trinidad, you should check it out. And from March,
Mm-hmm.
it was downhill. You
Yeah.
understand? But otherwise, she said there were no signs, so everybody found it was really amazing. So I don't know if she had it or
So
whatever,
you
but we
believe it or not, Michelle,
mhm.
there are
Yeah.
subtle signs that we ignore.
Okay.
Subtle signs. You should never, ever, ever have any kind of, if you pull on your underwear and you see any kind of pinkness on your underwear and you know you went through menopause already,
Yeah.
you should never have any what we call spotting or bleeding
Mm.
after menopause. It is cancer. So sometimes you might see that, but you ignore it because you're thinking
Okay.
it's nothing.
Yeah, yeah.
Um, and then, like you said, she started to feel the hardness around her navel. That's already end stage because you don't get any early satiety, any fullness, etc.
Mm.
And weight loss is the number one sign of cancer.
Mm.
Unintentional weight loss and fever with chills in the nighttime. Those are the most common signs of any type of cancer. Unintentional weight loss and fever with chills in the nighttime. We call it B symptoms.
Okay, well, it's only from March she started to lose weight, so I guess that time
It
probably
was
that,
already
that
done. Yeah,
yeah.
far on.
Mm-hmm.
Yeah. But that's
Okay,
why
then, thank you.
screening is important with your doctor. So your
Yeah.
doctor will be able to examine you and send you for the right tests and all these different things.
Okay, I have already made a appointment to do some tests.
Very good. Mhm.
Yeah. Okay, thanks a lot.
You're welcome.
So Dr. Chandler,
Mhm.
do you just go to a general practitioner to do the breast examination,
Yeah.
or do you have to go? So
So,
any old doctor could do the examination.
well, it's so, I mean, it's who you're comfortable with. You mean I want a male? So you could go by a general practitioner like myself, or you can go, if you have an OBGYN, you could go by an OBGYN as well.
And you don't have to
And
get a referral to go to the OBGN.
no, not, no.
Okay.
If you have a OBGYN that you go to regularly, you don't need a referral. No.
Okay.
Yeah.
Some people believe that the mammogram machine
Oh,
gives you cancer. Can
right.
you
So
speak to that, please?
yes. So those are what we call myths. So the amount of radiation, we call it cancer myths. It's a question that I get all the time. I had it in the presentation and I took it out, but I think I need to put it back because a lot of people ask it all the time. So the amount of radiation that is emitted by the mammogram is so minute that there is, I shouldn't say there's no way, but it's from statistical data and scientific knowledge, it does not convert the cells, and it's done so quickly, it does not transform the genetic makeup of the cells within the breast into a cancer. This is from my knowledge, and this is from what I read. Because a lot of people, it is what we call a medical myth with respect to mammography. But I don't like to say the word can't because people, it kind of comes across as ignorant, but it does not. A mammogram does not cause breast cancer. It does not.
Some people also believe that if you get a hard lash in your breast, that could cause cancer.
So usually the hard lash, what happens is that it causes a hematoma first. So when you get a lash, for example, in an accident, right? And the seatbelt snatches on the breast, or the airbag deploys and it hits the breast, or even trauma, physical trauma. What happens is that the breast is glandular and fatty, and it has a lot of microvessels, or it's highly vascularized. So there are a lot of vessels within the breast tissue. When there's trauma to the breast, those blood vessels rupture or they burst, right? And when they burst, they leak blood or extravasate blood into the fat cells or the tissue within the breast. When that happens, the breast first undergoes a discoloration to the breast, just like when they get hit on the skin, etc. So initially it might be kind of dark red, purplish, red, and then it may become black. And as it goes through those skin changes, the tissue itself also goes through skin changes where it will feel very firm initially, and then over a period of time, it would become softer. What happens is that the body, um, when that lash also happens, it sends different cells to clean up the blood that has leaked that shouldn't be there. It sends cells called macrophages to clean it up. And within that period of time, it may also form some microcalcifications, which is the normal process of 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 um of breakdown of blood vessels underneath the skin. So I have I only started hearing that trend, that talk recently, but from my knowledge and from my reading and from my learning, I don't see how it could happen because the body will absorb the lash. It will absorb it over a period of time. So it's a belief, but I believe it's a myth because that's just not how cancer works. Cancer is an abnormal growth of abnormal cells, whether it is due to a genetic predisposition or if the cells themselves convert over a period of time. But I kind of hope that answers it, but it is a myth. Because in that sense, if you get a hard lashy skin, for example, then you may get skin cancer. I just saying. But yeah, I've heard it. I don't know if anybody wants to debate it, but yeah. Any other questions?
Yes, I was asking a question, but my mic was muted. You mentioned earlier that it's a good idea to join the clinic, although it may take a long time. At what age can somebody join the what clinic is available for breast cancer? Is it
It's
family medicine?
family planning, so a family medicine clinic. So it wouldn't be things like chronic disease, it'll be family planning. However, your first point of entry into the hospital is always your accident and emergency. So from your accident and emergency, your doctor, who you see in accident and emergency, will join you into the clinic. There are some clinics, some RHs allow you to walk into the family planning aspect and ask for that particular service. But a lot of the times you have to kind of go through A&E. But now the government is improving in terms of healthcare and stuff. So you could go to your family planning clinic, which is your regular local health center.
Okay. Thank you. Any other questions, anyone? So we said we would go until 9:10, and it is now 9:13. Dr. Chandler, this has been a very informative session for me, and I thought I knew quite a few things about breast cancer, but it has been an eye-opening session for me. And on behalf of the team, I would like to thank you very much for giving up your time on this public holiday when you could have been out looking at the lights and watching the fireworks, etc. We want to really thank you from the bottom of our hearts for making this possible for us, for engaging us to help us to learn more. And we want to wish you all the best as you continue to build the nation by bringing the information to the places where it is most needed.
You're welcome.
So thank you so much. And I see Sherry Ann David is sending you applause.
Thank you.
Right, and Dwayne Andrews. Thank you so much. Nikki Carew is also sending. I don't know if I know how to do the
applause.
The applause, how to do the emoticons, or whatever you call it. So thank you very much. And we will record this and have this available on our YouTube channel so that other persons can see. And we're hoping that if you are going to be anywhere else during the month of October, just send me a message and I'll pass it on to our contacts so that they can follow up on further information.
I will. Thank you so much for having me.
You're welcome. And it's always wonderful to see students who have passed through your school succeeding, but more so giving back to the community.
Yeah.
So thank you for your generosity. God bless.
You're welcome. Bye, everyone. I got to put my daughter down. Bye.
Yes.
Yeah.
Take care. Bye-bye.
Bye.